there are many factors, but the root cause is thought to be pain amplification, which is what happens in the brain when too many signals are passed up for too long, that the pain gets amplified in certain areas of the brain, which we know are responsible for processing pain. So in the end, the brain gets confused and it starts imagining or thinking that the pain signals mean that the muscles are under attack, under pain stimuli all the time. So instead of being able to switch off and having a rest, that you get a constant bombardment and signalization that everything is on fire the whole time. The most prominent thing is widespread chronic pain. So usually in the muscles. This is also associated with a sleep disturbance. Almost all patients have sleep disturbance, and extreme fatigue. Patients can feel exhausted after doing very little exercise. And so they begin to perceive themselves as not having enough moral fibre. Unfortunately, that's reinforced in society as well, that people are often treated quite badly. They're perceived to not be trying hard enough, to be malingerers. It couldn't be further from the truth. People are in pain, it just can't be seen, but it needs to be evaluated by a qualified person who's used to seeing this condition. In terms of, it can vary. So in daily life, patients are in a wide spectrum. So some of them feel exhausted and can't get up in the morning and find it too difficult to do anything. Some patients have a milder form of fibromyalgia. So once they get going, they can actually perform a limited day of activities. But all of them find that their daily activities are curtailed by fatigue, pain, and feeling generally under par the whole time. So it's a bit of a circular argument. So per se, fibromyalgia doesn't cause weight gain, but because of all the restrictions and exhaustion, patients often begin to gain weight, which compounds the problem. So they get more pain signals from overstressed joints, which are carrying more weight. So yes, it can be associated, it's commonly associated with weight gain, because people are not able to exercise and move around in the same way. So unfortunately, in this country and in the US, there are virtually no licensed treatments for the treatment of fibromyalgia. In the UK, there are no licensed treatments. In America, I think it's just duloxetine, which is an antidepressant, which is used. That said, people are using antidepressants, brain stabilizers like pregabalin, gabapentin. The point is that ordinary analgesics don't seem to work very well, and non-steroidal anti-inflammatories, which you do use for inflammatory arthritis, don't seem to have much of an effect. So patients are in a really stuck situation, and at the moment that they have been sort of, there's a new nice guidance which has said that GPs should not prescribe painkillers and even other drugs for fibromyalgia, because there's so little evidence that they actually work. But that doesn't leave a very satisfactory answer for the patients on a daily basis. So pain consultants will use pregabalin, gabapentin, and a range of other medications, and sometimes they work. Looking at the whole thing holistically, I think patients have got to make sure that they have good sleep, get into a good sleep pattern, try and restrict the stress stimuli that they get, and try to do some, regular but very limited exercise to keep the body going. But we've actually come across, and I've been working with London Psychiatry Clinic for the past 10 years, who have been treating patients for depression and anxiety with a system called repetitive transcranial magnetic stimulation. And what we found is that stimulating areas of the brain can, with the magnetic stimulation, which is non-invasive, non-toxic, it can improve the pain pathways, improve the pain threshold, and help with fatigue and sleep. So this is a big breakthrough. And there was a very interesting paper carried out last year by Tanwa et al. And, you know, we'd be able to provide people with lots of information about that from our website.